Assalamualaikum, I bid to all the examiners.
I am Zulaikha Binti Zulkefli and my metric number is 2020978669 with my partner.
I'm Nurulaini Wahida Binti Mohamad and my metric card number is 2020984487.
We'll be presenting our proposal for parents' intention toward childcare services for children under age 3 in Ipoh, Perak. The content of this presentation will be the background of study, problem statement, research question, research objective, conceptual framework, research methodology, findings, limitation of study, recommendation, and conclusion. For several decades, researchers, governments, and childcare providers and parents have paid close attention to the quality of childcare facilities. Childcare provides a place where most children under age 5 can engage in daily learning, play, and interactive activities that promote cognitive and social-emotional development. Different childcare environments, including center-based programs, informal relative, and home care, each have distinctive qualitative advantage and disadvantages. It has been revealed that program quality plays an essential role in the long-term effect on social, emotional, and cognitive development. Researchers have been studying what defines quality in childcare and how it influences children's development. Numerous studies have found that childcare quality is related to children's growth, particularly cognitive, linguistic, and social development. Hence, parents are worried about the standard of early childhood education. Therefore, when it comes to getting a high-quality childcare services, parents play a crucial role. Furthermore, parents are consumers of high-quality childcare. In Malaysia nowadays, most parents, particularly those in metropolitan areas, are both employed. As a result, the need for childcare centres to care for their children is growing. The increased participation of women in the labour market in Malaysia also has resulted in a significant demand for childcare services. Therefore, according to CHIAM, the quality of Malaysia's childcare services is deplorable. The childcare centres' premises could have been better built, healthier, and riskier for young children. Most childcare professionals had little or no education and had not received any training as a childcare providers. This is because one would expect a parent to demand excellent childcare for their children. However, there's a small minority who could care less about the quality of childcare services because they are satisfied with the custodial care. Moreover, most tasker operators who were neither teacher nor minder possess appropriate academic qualification, and according to the news from Bernama, a total of 1,685 childcare centres, including 938 nurseries, have been recognised as illegally operating since 2014, which has resulted in the safety and quality of childcare centres in Malaysia require additional improvement given the growing number of negligence and mistreatment incidents that could be fatal to children. To add, parents consider cost and the flexibility of hours, location, as well as transportation before sending their children to childcare centres to regulate the external element, as the cost of childcare services are expensive nowadays. For the research question, we are able to come up with 3 research questions to understand better the parents' intention toward childcare services for children under the age of 3 in Ipoh, Perak. The first one is, what is the level of parents' intention toward childcare services for children under the age of 3 in Ipoh, Perak? Second is, what is the relationship between the attitude, perceived quality, perceived behavioral control, and subjective norm with parental behavioral intention in Ipoh, Perak? And lastly is, what is the main predictors that affect parents' intention toward childcare services for children under the age 3 in Ipoh, Perak? As for the research objective, it is formed to meet the research question, and this objective will act as a framework for performing this research report. The first objective is to examine the level of parents' intention toward childcare services for children under the age of 3 in Ipoh, Perak, followed with to analyse the relationship between attitude, perceived quality, perceived behavioral control, and subjective norm with the parental behavioral intention in Ipoh, Perak. And lastly is to determine the significant predictors that affect parents' intention toward childcare services for children under the age of 3 in Ipoh, Perak. Next, we move on to conceptual framework. This study used the planned behavior underlying theory to analyze characteristics that impact parental behavioral intention toward childcare services for children under the 3 years old. According to the TPB, conceptual framework parental behavioral intention toward childcare services for children under the 3 years old was influenced by many predictors, including parents' attitude toward childcare services, perceived quality of childcare facilities, subjective norms relating to sending their children to childcare service, and the perceived behavioral control. Hence, this study research paradigm comprises attitude, perceived quality, subjective norms, and perceived behavioral control, and it intends to understand and investigate parental behavior intention toward childcare services. Therefore, there are 4 independent factors affected parental behavior intention. The first one is attitude, followed with perceived quality, subjective norm, and behavioral intention. For research methodology, it is the last phase evaluates the procedure for gathering data and data analysis, where statistical techniques will be applied to judge the validity of hypotheses. The designation of questionnaire essential for carrying out this study and measuring the variables of interest in the research. The research design used for this study is a cross-sectional study, and hypothesis testing were employed to ascertain the relationship between attitude, perceived quality, perceived behavioral norm, and subjective norm, with parents' intention toward childcare services. Additionally, a quantitative approach was applied to provide the most reliable result of this study. As for unit of analysis, parents that reside in Ipoh region were targeted for this group, and the sample size used for this study is 100 parents from Ipoh. For the sampling technique, the non-probability sampling method are used in this study are purposive and convenient sampling, as this study aims to obtain information from a specific targeted group. Therefore, this study emphasized and specified the group of respondents who are parents living in Ipoh. As a result, persons who are parents living in Ipoh were chosen based on the study's research objective and their availability to complete the questionnaire. For the measurement, respondent adopting measurement based on the variables utilized in this study is attitudes, perceived behavioral control, perceived quality, and subjective norm. Questionnaires were developed with that purpose in mind. The survey questions were translated into Bahasa Melayu and published in English, and the elements are described as below. The questionnaire then were distributed through Google Forms and used Bahasa Melayu as a data collection. As for the data analysis, researchers use descriptive statistics with mean and standard deviation will be run and analyzed, and Pearson correlation will be utilized to examine the relationship between parental behavioral intention with attitude, perceived quality, perceived behavioral control, and subjective norm in Ipoh to identify the critical predictors of parental behavioral intention in Ipoh. Let's proceed with our findings. The survey was carried out by delivering online questionnaire to 100 respondents who are parents in Ipoh, Perak, and it took approximately 2 weeks to complete. Researchers able to gain 108 respondents from 100 targeted respondents, which surpassed the number of targeted respondents. As a result, the overall response rate was 100%. The overview of the demographic of the respondents who participate in this study can be seen in the table shown. To summarize, the majority of parents who have kids under the age of 2 is 54% compared to children between the age of 2 and 3. As for the tertiary education, it is the most prevalent degree of education for mothers, as it is 76.9% higher compared to others. Next, regarding the mother's age, 35 is the dominant age at 85.2%, and over 37% of respondents work in the private sector, while 35.2% work in the public sector, followed by 19.4% who were self-employed.
Hello, my name is Nurulaini Wahida, and I will proceed with the following finding: goodness of measurement. Assessing the goodness of measurement is critical to ensure a more accurate outcome and improving the quality of research. First, a reliability test was run. Chromebook Alpha is the most often used statistical tool in reliability analysis to assess how well variables are connected. According to Sekaran and Buji, a dependability coefficient of less than 0.6 is deemed poor, a range of 0.7 is acceptable, and a value of 0.8 or greater than 1 is considered good. Number of items here refer to numbers of questionnaire that had been asked according to the variables. So as a result, all the factors examined in the study were more than 0.6 and proved reliable. Second, a normality test was run. Skewness and kurtosis measurements can be used to determine normality to some extent. Moreover, clients stated that the skewness value should fall within the range of -3 to 3, and the kurtosis value should fall within the range of -10 to 10 to indicate normal distributions. And according to SPSS output, all the variables are normally distributed because all skewness and kurtosis values are between -3 and 3, and -10 to 10 reflect a normal data distribution. Next, as had been explained previously by Zulaikha, for this research, we have 3 research objectives. The first objective is to examine the level of parents' intention toward childcare services for children under the age of 3 in Ipoh, Perak. This study used descriptive analysis to examine the mean and standard deviation variables. Based on the result, the mean score was 3.63 with the standard deviation of 5.02. Hence, it implies a moderate level of parental behavior intention among parents in Ipoh, Perak. The second research objective is to analyze the relationship between attitude, perceived quality, perceived behavior control, and subjective norm with parental behavior intention in Ipoh Perak. Therefore, a Pearson correlation analysis was tested. Cohort 1988 classified ARC values ranging from 0.10 to 0.29 as low, 0.30 to 0.49 as moderate, and 0.50 to 1.0 as high. By referring to the table, a correlation between attitude, perceived quality, perceived behavior control, and subjective norm with parental behavior intention in Ipoh Perak demonstrate a significant strong positive correlation. This decision supported hypothesis 2, 3, 4, and 5. The third research objective is to determine the significant predictor that affects parents' intention toward childcare services for children under 3 in Ipoh Perak. So multiple regression analysis was used. Based on the table here, if we look at the R2 values, it represents the independent variables 87% of the variance in parental behavior intention, which is highly significant. So the F value is 175.606. So the model is statistically significant as the p-value shown here is p less than 0.05. So in the current research study, 4 predictors were identified as independent variables, which is the first one is attitude, perceived behavior control, subjective norm, and perceived quality. So among these independent variables, only one significant predictor was found to be, which is attitude, since the p-value is less than 0.05. So another 3 independent variables were found insignificant due to the p-value more than 0.05. Therefore, it can be concluded that attitude was the most significant predictor that affected parental behavior intention toward childcare services under 3 in Ipoh Perak, since the standard beta value is greater than other variables. Next, let's moving on to the limitation of the study. We managed to find 4 limitations of this study. First, respondents were only involved parents that live in Ipoh Perak. Thus, the findings of this study do not reflect the level of parental behavior intention toward childcare services for the whole population in Malaysia, as the findings of this study only represent parents who live in Ipoh Perak. Second, the restricted numbers of predictors tested. In the current study, only a few independent variables were discussed, which is attitudes, perceived quality, perceived behavior control, and subjective norm. However, the study did not test other factors influencing the parents' behavior intention toward childcare services. Next, the current study only investigates the predictors that affect parents' behavior intention toward childcare services under age 3 in Ipoh Perak. In addition, to the best of our knowledge, no specific studies have been conducted on the predictors that influence the parents' behavior intention towards childcare services under age 3 or above. Hence, this may constitute the objective of future studies to investigate the parents' intention to send their children above 3 years old to childcare services. Lastly, the limitation of the study was its technique. The approach utilized in this study was a quantitative method in which the researchers used questionnaire to collect the data from the target respondent. As a result, using this strategy, researchers cannot generate numerous viewpoints from various respondents. Thus, in the future, we hope that research can employ various data collection methods, such as qualitative approaches that require conducting direct interviews with 2 or more individuals simultaneously. And the last would be recommendation. Nowadays, childcare centers is very different compared to a few years back. Childcare services are one of the necessities of families. However, with the numbers of incidents that occur in childcare services, it is time for recent research on childcare centers to be done so that the policies drafted, the provision legislated, and the training provided to childcare providers and caregivers suit the current time and demand. It has been almost 30 years since the birth of CCCA in 1984. Therefore, it is reasonable for an evaluation to be made of the provision of the Act itself. Second, a good and professional teaching team is essential for childcare center, especially those with the knowledge and skills of early childhood education. Hence, the requirement for all childcare providers to attend Permata childcare course. The content was then enhanced to suit the local culture and the spirit of national education philosophy. Permata childcare course may be a solution in training the childcare providers to be more professional in dealing with the children. In conclusion, the study was conducted to predict the parents' intention of childcare services for children under age 3 in Ipoh Perak, where the numbers of respondents from the survey was 108. So this study finding shows that the attitude is the most influential predictor affecting parents' intention. And with that, we will end our presentation. We will respond to any comments or question in the comment box. Thank you and have a nice day.